Hi, I'm a PsyCHNP and I have another practice quiz for you. This time it's on psych meds. Question 1. Which of the following questions would you ask a woman to assess for hyperprolactemia as a side effect of antipsychotic medication? A. Are you having trouble sitting still? B. Are you constipated? C. Are you having discharge from your breasts? Or D. Do you have dry mouth? Answer: C. Are you having discharge from your breasts? So this is describing galacturia, which is a symptom of hyperprolactemia. The inability to sit still, that could be maybe akathisia, and that dry mouth constipation, that's probably an anticholinergic side effect. Question 2. You would be alerted to assess for signs of lithium toxicity in patients with which of the following lithium levels? A 0.5, 1.5, B 0.1, C 0.5, or is it D 1.0? The answer is A, 1.5. Got to know these lithium toxicity levels. I did include a slide so you kind of know the different ranges, if it's acute, long-term, therapeutic goals, all that. Make sure you know this. Biggest thing for this, the answer is 1.5. There's significant side effects that will present in a patient when their lithium level is above 1.2. Question 3. Which of the following medications carries the highest risk for QTC prolongation, and thus you need to monitor for cardiac side effects most carefully? Is it A, thyroidazine, B, risperidone, C, quetiapine, or D, olanzapine? The answer is A, thyroidazine. So why is that? This medication does have that FDA black box label to call your attention to that risk of QTC prolongation, significant of the meds listed. Question 4. The client has received Abilify on the admission to inpatient unit with a diagnosis of schizophrenia, paranoid type. Which of the following is a sign that Abilify is becoming effective? A. The client paces in the hall and engages in solitary activities most of the day. B. The client sleeps for shorter periods of time during the day. C. The client establishes eye contact and remains in conversation with the nurse for longer periods. Or is it D. The client only eats food that is in the original container, such as individual packages of crackers? The answer is C. The client establishes eye contact and remains in conversation with the nurse for longer periods. Because suspiciousness is the central feature of paranoid delusions, efficacy is shown by the client demonstrating behaviors that suggest increase in trust in the nurse. Sleeping less during the day is not a sign that the medication is alleviating the psychotic symptoms, and engaging in solitary activities and eating prepackaged foods are signs actually of paranoia. Question 5. A family member tells you, I think my sister needs more medication because she still says she cannot sit still and is moving her legs back and forth. The patient is on risperidone and was recently increased to 10 milligrams daily. What is the correct response? A. I will check with your sister because what you're describing sounds like a side effect called akathisia. Or B. I will check to see what your sister has been prescribed because some clients get anxious when their medications are increased. C. I will see if your sister has been prescribed a medication to counteract the dystonic reaction she is having. Or is it D. I will call the doctor and report that your sister is developing a tolerance to risperidone and the dose is not effective. Gosh, really hope you got this one. This is an easy one, I think. A. I will check with your sister because what you are describing sounds like a side effect of akathisia. This will probably be on one of your tests, so yeah, let's know this one. So what is it? It's the inability to sit still for more than a few minutes or feeling of not being able to sit still at all. It is a side effect of antipsychotic medications that can be very distressing to the client. You should assess the patient to determine if she has akathisia. It would not be typical for a client to get anxious just because the medication was increased. A dystonia would be an abnormal tonic muscle contraction. Risperidone is not addictive and clients do not develop a tolerance to it. Question 6. A patient is taking a medication to help cope with EPSEs, but cannot remember the name of the medication. Which medication is he likely taking? Is it A, risperidone, B, duloxetine, C, lozapine, or D, benzotropine? The answer is D, benztropine, also called Congentin. So this medication is an anti-Parkinson drug, but it is used to manage the EPSEs of antipsychotic medications. The other medication of risperidone and loxapine, those are antipsychotic medications, but duloxetine, that's an antidepressant. Question 7. You're monitoring a patient that's taken venlafaxine. What will you watch for? A, increased weight, B, prolonged QTC interval, C, increased blood pressure, or D, tardive dyskinesia. You're going to look out for that increased BP. Sustained increased blood pressure has been noted in some patients when they are on a higher dose of venlafaxine, but weight, QTC intervals, and tardive dyskinesia, those are not typical side effects of this med. So increased blood pressure. Question 8. Patient's been taking fluflosamine for years and has been symptom-free for 1 year and is now considered taking a drug holiday. What teaching is necessary? A, the client should be symptomatic-free for at least 2 years before trying to get off the medication. B, the client should let the prescriber make these decisions and should not suggest this. C, a drug holiday should be avoided due to discontinuation symptoms. Or D, this is worth trying since the client has been symptom-free for a year. The answer is C, a drug holiday should be avoided due to discontinuation symptoms. So with this medication, you can't just discontinue. You have to do a gradual taper down to avoid discontinuation symptoms. So if it's the nurse, have the patient discuss it with the prescriber. If you're the prescriber, you're the NP or the MD, definitely talk to them about this because you'll have to devise a taper down schedule. Question 9. A patient is taking an MAOI and should be taught to completely avoid which of the following foods? A, white wine, cottage cheese, and ice cream. B, steak, potatoes, and corn. C, bread, apples, and hamburgers. Or D, liver, sauerkraut, and yogurt. The answer is D. So clients that are taking MAOIs, they should be taught to avoid foods containing thiamine. These are things like liver, aged cheese, red wines, sauerkraut, and yogurt. Additionally, caffeine, colas, chocolate, soy products, aged fish, and processed meat, they also contain thiamine in higher amounts. But white wines, cottage cheese, ice cream, bread, apples, hamburgers, steak, potatoes, corn, egg, those are allowed. Question 10. Which of the following drug is indicated in refractory schizophrenia? A, Haldol, B, lithium, C, clozapine, or D, thyroxidine? Answer C, clozapine. So this medication is the only FDA-approved medication for treatment of resistant schizophrenia. It treats symptoms of psychosis like hallucinations and delusions. It also improves the mood and behavior. Question 11. Which of the following is a direct pharmacological antagonist? A, escitalopram, B, paroxetine, C, venlafaxine, or D, amitriptyline? Gosh, a lot of them are. Did you get them all? A, B, C, and E are. So all of them are except for venlafaxine. So a direct acting antagonist binds to and blocks neurotransmitters receptors, thereby preventing the neurotransmitter themselves from attaching on the receptors. All right, thanks for staying with us. All done. Good luck on your test.